Obama's plan to provide medical insurance for all Americans is a step closer to becoming a reality. The leaders of the healthcare industry are offering $2 trillion in spending reductions, while hospitals, insurance companies, drug makers, and doctors plan to slow their rate increases.
$2 trillion in hospital reductions and all that. $2 trillion, the insurance company. There's a catch there.
A whopping $2 trillion.
Of course, we gotta print money to show what money is. In case anyone doesn't know what money looks like, there it is. That's how it's made.
$1 billion over 10 years. The savings health industry leaders are offering the Obama administration. The same health leaders who fought the Clinton.
Ho. Let's rewind that a little bit. How much are they offering here?
A whopping $2 trillion over 10 years.
What? There's the catch. Over 10 years. They make $2 trillion in a year. No. In a month, they make $2 trillion easily. They could offer a hell of a lot more to make it a hell of a lot easier for the average American.
Health industry leaders are offering the Obama administration. The same health leaders who fought the Clinton administration when they took on health care, killing any proposals before they could gain traction. The change of heart is self-serving. Health industry groups want to get on the Obama bandwagon for expanded coverage now in hopes to steer Congress away from legislation that would restrict their profitability in future years.
No wonder. In other words, folks, what they're doing is they're paying up now. This way, what they're doing is they're paying so they can make sure, it's like buying an insurance policy, so they could make sure that later on there won't be no laws passed where they can't raise their prices anymore.
Insurers, for example, want to avoid a competing government health plan. Drug makers worry in the future new medications might have to pass cost-benefit tests before approval. And doctors worry.
You know what? They should pass cost approval tests. I swear to God. You know why? Let me tell you something. The biggest goddamn ripoff that I've ever seen is an aspirin. Aspirins, they can make like 30 for a penny. And yet you go to a hospital and they charge you for the same aspirin that you buy in the store for $5, $6 a bottle. They charge you for one aspirin like $50. Holy goddamn shit. For the same a Tylenol. Oh God, don't ask for a Tylenol. That's a fucking whopping $100. You know, they should have cost approval and stuff like that. Other countries have it. Cuba. I mean, small countries, they have actual no-cost care for anyone that walks in. England. Okay, England is not a backwards country. And yet the doctors are living good. You know what? England, there is no cost. You can walk into an English hospital. I need this done. No sweat. And you get the top that they have. The best that they have trying to do that for you. To help you out. Over here, you pay hundreds of thousands of dollars. You get Joe Quack.
The government could decide what they get paid for all patients, not just the elderly and poor. This is the health industry's attempt to play ball and avoid financial collisions with the federal government. Now, 6 major groups plan to deliver a letter today to President Obama. They plan to cut the rate of growth for health care by 1.5% every year for 10 years. And when you add that all up, you get the $2 trillion in proposed spending reductions.
Yeah, but the whole thing is, you know what? This is the first plan I hear Obama that's heading on the right goddamn track. You know what? Yeah, they should put health spending and all this shit, because that shit's going off the fucking scale. Some people are afraid. They could be dying in their house, and people are afraid to go to the hospital. You understand that? Because they can't afford what the hell they're going to do to them financially. You understand? They don't care what happens to your goddamn name. They're going to put you through all kinds of shit. Charge you it costs $300,000 to give birth to a child. Holy shit. It just shoots out. That's all. It just shoots out. I mean, I'm not giving it any less to the mothers of America that give birth. But come on, $300,000 to give birth because you provide a bed. Holy shit, man. Giving birth is a natural thing, yet they charge $300,000. You know, they should be regulations. They should be all kinds of shit put on that shit. They should watch them. They really should. Okay, this is what you're getting for each patient. That's it, no more. And put it at that. You understand? But yeah, you got to control everything that involves the hospital too, because then the hospitals start collapsing and all that. You know what? This is a program that could really work out if they do their fucking homework. You understand? Not just provide health care, but try to help them hospitals stay in business. Okay? Change the prices for not just fucking the medical help and all that shit, going to the doctor, but the fucking pharmaceuticals, which are off the fucking scale. Holy fucking cow. If you want antibiotics, you better have a fucking credit card and all this shit. You know that? Otherwise, you're not getting the cocksucker. Holy, I mean, the price of pharmaceuticals have gone off the fucking hook. As well as the doctor care and all this shit. There should be something that should be... This is going on the right track. And I kind of go with Obama on this one. But you know what? They're going to have to fucking do something that counts. Okay? And this shouldn't be a fucking show. And you know what? The American people have got to fucking make a lot of goddamn noise. Otherwise, they're just going to take it their way, and in 10 years, they'll be back to the way the fuck they were in the first place. Because 10 years is not that long. Before you know it, it's right on top of us. Flavio 13 out.